Welcome to the Birkbeck Connections video series. We're absolutely delighted to be introducing Birkbeck Connections in organisational psychology. And this aims to bring our professional community together to connect, to share the latest evidence and trends in practice and learn from each other. And in this series, we're inviting academics from across the department to share their research. And in the future, what we hope to do is to host networking sessions, group discussions, so that we can really help to engage the conversation around organisational psychology and its contribution in the workplace. So today I'm here with Professor Gail Kinman, and I'm absolutely delighted to be introducing her and looking forward to hearing more about her work. Professor Kinman has joined the Department of Organisational Psychology as a visiting professor and previously holding roles at the University of Bedford. And her work has really focused on supporting helping professions. So looking at the experiences of social workers, of prison officers, and others that are in challenging situations and really need to draw on their resilience to get through the day-to-day challenges of work. So today we're really looking forward to hearing more about her work with social workers. And so Gail, I wondered if you could start us off with telling us a little bit about the work that you've been doing with social workers.
Thanks very much, Jo, for such a lovely introduction. Well, I first started being interested in this notion of emotional resilience in the so-called helping professions about 10 years ago. And it was talked about like this quality that, social workers and other professionals were supposed to have. But nobody really knew what it meant or fully understood the characteristics that underpinned it. What was a resilient social worker like? So then I was very lucky to literally bump into somebody who was a social work academic and a former manager of social workers. So she was very, very experienced at managing staff. And we had a chat about this, and she said, well, she was always very interested in how some social workers were able to cope fairly well with the job, which is enormously emotionally demanding and complex, whereas others couldn't. So we kind of joined together, and we first of all started to look at the characteristics of resilient social workers, essentially, because it's a bit like stress. It's a lot of different meanings to different people. So we started looking at the characteristics that underpinned resilience in social workers and found a range of individual competencies. Most important was something called emotional self-efficacy and also emotional literacy. Now, we shied away from using the term emotional intelligence because in my experience, people see it in quite an evaluative way and often mix it up with, the classic intelligence, or G. It's quite evaluative. So we chose to look at emotional literacy. And what this really meant in the context of social workers was people who were able to pay attention to their moods and emotions, who were able to name them, they knew what they were feeling, if you like, and were able to repair them. They knew what to do, the coping styles perhaps that would make them feel better. And I think most importantly, in terms of emotional literacy, was they were very aware of the potential impact of emotions on problem solving. Because, of course, when you're dealing with a complex situation with a service user, acting on emotion is obviously not going to be the right thing to do. So emotional literacy was really key. But there were other very important factors like psychological flexibility, support, social support from within the organisation, but also at home in personal life. We also looked at something called accurate empathy. Now, I always thought, and most of us would say that social workers and people doing this type of work, you should be empathic and compassionate. I'm sure you'd agree. But actually, you can't be too empathic. So what you really need to be able to do is take somebody's perspective, or think you can, because it's probably quite dangerous to believe you can, because you probably can't. So try to take somebody's perspective, show some concern for them, but avoid this empathy spilling over into distress, because that's going to cause problems for the boundaries between yourself and the people that you work with. So all of these factors kind of predicted emotional resilience in individuals. And in turn, resilience was very strongly related to mental health and to some degree to physical health. So we did find some interesting issues there, fortunately.
Sounds fascinating, and also I think really interesting to think about the broad range of psychological theories that underpin some of the competencies that you're talking about there, but also making them very practical and thinking about how a social worker or a manager can help to implement them.
Definitely. So we've, obviously we can't just measure things. We have to try to find effective interventions that can help make people more resilient in that context. So we've conducted several intervention studies with social workers at various stages in their journey, right the way from students to early career staff, in the first year of their work. And that's a particularly challenging time. And that's a time where we often lose social workers. They drop out because of the stress of the job. So it was very important to look at them, and also more experienced staff. So we've done interventions looking at multimodal strategies, including mindfulness, CBT skills, etc. And we did an evaluation of an 8-week mindfulness course more recently. And that had a lot of benefits, not only for individuals' stress levels and emotion management, but also for their work, their problem solving and their job performance.
So, and how did you go about measuring those other outcomes? Because I think in the work that we've seen, and we've conducted a systematic review looking at the impact of mindfulness in leaders and their performance, and that measurement of performance is really quite elusive, isn't it? So how did you go about looking at the impact?
It's very, very difficult to measure performance. Now, unfortunately, at the moment, we've only looked at self-reported performance through quantitative and qualitative means. People were saying things like, well, I find it much easier now to go into court because I just do something like, a 1-minute anchoring exercise. And it kind of centers me in terms of being in a very stressful situation. And I think with social workers as well, because they have to see one service user after the other, and they're likely to have some pretty complex problems, and you need to kind of park your emotional responses to one service user before you go on to the next client. That's mindfulness is very useful for that as well. So, but of course, like any technique, you have to use it. And we certainly found that social workers, their self-care isn't great. They tend not to, obviously I'm generalizing here, but they tend not to prioritize their own well-being. And that is a big issue. We had several people saying, well, I'd love to be able to do this because I know that mindfulness is important for me, but it feels like a bit of a luxury when, the people that I'm working with, the service users, need me. So I need to be focusing on them, not myself. And that can be a problem.
How do you try and encourage people to do that? Because I think across the area of health and well-being, those that often need to look after themselves and prioritize exercise and good nutrition and taking time to take notice don't do the basics because they are so caught up in managing others and trying to meet the demands of work and home. And so have you found anything particularly effective at getting the buy-in and prioritization, particularly from those that are poor at self-care?
I think that's a really, really good question, and it's a difficult one. Certainly, when we measured the ability, to prioritize self-care, let's say, we found that it wasn't really a very powerful predictor, because people, I think, probably get entrenched earlier in their careers. So what you really need to do, and certainly what we found, is that early career and student social workers do need to have this input at a very early stage. And what another study that we conducted was we got some very experienced social workers into the classroom with students, and they talked about the importance of self-care, and they also talked about some very challenging cases that they dealt with and their own emotional responses to it, because the students found it very difficult at times to acknowledge that they were experiencing negative emotions. And it's almost like, these experienced staff gave them permission to do that. And, that's really going to be helping. And certainly, the feedback afterwards was very powerful indeed. And as part of that, we found that emotional writing was very important as well. And there is some evidence, not from our own research, but from other studies, suggesting that it only takes about 2 minutes a day. You can get benefits, for physical and mental health, just writing about your emotions. So getting into good habits early on, I think, is key. Sometimes if the average life, I'm saying life, a professional life of a social worker is only about 8 years. And lots of people drop out because of the stress of the job. So, the risk is that if you get into bad habits when you're in the early days, you're probably more likely to drop out. So we've designed lots of different interventions that inform what we call an emotional curriculum for social workers and student nurses as well, because they have similar emotion demands, and that gets them into the habit of talking about their emotions and trying out different types of self-care strategies, like developing their own toolbox.
That sounds really interesting, because there's just so many different things, aren't there, that are needed.
Oh, absolutely.
And at different times. And so to be aware that you might need a really broad, full toolbox is
definitely
a great thing to enter the workforce with.
Yes, because certainly what we find is that no particular coping style is effective at all times. And it's the social workers that have a kind of coping flexibility, where they're able to select the most appropriate coping style, for the particular problem. They're the ones that are more likely to thrive. So flexibility is important.
Yeah. I was wondering if you could tell us a little bit about the new SWORD diagnostic tool and workbook that you've developed, and how that links into this.
Yes, of course. Certainly, our early work looked at the individual characteristics of social workers that made them more resilient to stress. But all along, obviously, we were very, very concerned with demonstrating the importance of the organisation's duty of care. So, social workers that are very resilient, the most resilient social worker, won't be able to cope with toxic organisational conditions. So we always wanted to look at the qualities of the organisation, the characteristics of the organisation that will allow social workers to thrive. So this is really very much the work that we're doing at the moment. So what we did was we have been running focus groups, interviews, workshops, etc., with social workers from very different backgrounds, from trainees right the way up to directors of social services and charities, some pretty powerful people, to try to understand what aspects of the organisation will support resilient social workers. And, we came up with several structures, if you like. First of all, we have the learning organisation. Now, that's a term that's very much bandied around, isn't it? But of course, certainly we have some very high profile failures of care in social work, baby P maybe, for example. And there is a tendency, isn't there, to blame the individual. There's one bad apple in the organisation, and it's their fault. whereas learning organisations within social work support their staff and they look for errors, in a fault of the organisation, not the individual themselves. And, all things are opportunities for learning. So learning is very much um, embedded in the organisational system. Then we have a secure base, and that's very important as well. And it draws very heavily on this idea of attachment, that all of our psychology students will have learned about in the very early stage, that people need this secure base from which to venture forth and, sort of do their best performance, if you like, because they know that they have this supportive organisation there. That's incredibly important. And a key part of that is something called belongingness. And it's not something that's talked about very often in occupational psychology, but, we found it's very important, not only with social workers, but also for nurses, with other research that I've done with Adrian Sharples. And it certainly underpins good performance and well-being, feeling that you belong in the organisation. So organisations can do quite a lot, I think, to try to enhance this sense of belongingness in people. And, another key aspect, very important indeed, is obviously well-being. Now, this is the most important because it underpins everything in the organisation. So, good work-life balance, manages role modelling, healthy behaviours, etc., lots of support. So all of these things together certainly underpin and support resilient social workers. So as part of this SWORD source, we have designed a diagnostic tool. So the general idea is that this is now administered to local authorities and charities, and it's about to go live, actually, probably next month, we're hoping. But obviously the pandemic has delayed us ever so slightly. It has been piloted. So it'll go live to organisations throughout the country, and the tool will allow them to diagnose using a traffic light system, a bit like the Health and Safety Executive Management Standards. Whereas, are you okay in this particular domain? Do you need a little bit of input, in terms of perhaps amber and red? Obviously, you do need to put things in place to improve things in this particular area. So the workbook has been designed to help them do just that. It has lots of different evidence-based interventions from, fairly ambitious types of interventions to what we call quick wins. So it helps organisations improve in this particular domain, and then we would be re-administering the questionnaire is several months later, just to see if things have changed. So, we've had a lot of very good feedback from this tool, so we'll wait and see how things go. I can report back soon.
Yes, I think it's really helpful, isn't it, to have something that organisations can work with themselves, because they have so much expertise that they hold, but sometimes aren't necessarily aware of the frameworks or the missing part of the jigsaw. So something like this could be really helpful in ensuring that everybody links those key components together. And I think one of the things that it's really interesting here is the extent to which some of the things that you've been talking about being important in social work really resonate from all the work that Rachel and I have been doing in other sectors. And I was just wondering to what extent that you think some of the diagnostics and the interventions that you've been doing with social workers could translate across organisations, or whether you think there is this need for a context-specific approach.
I've always been a big fan of context-specific approaches because, having researched so many different occupational groups, the only thing they have in common, I think, is the jobs are emotionally demanding to some degree. I started off looking at academics, I've researched teachers, ministers of religion, which is quite interesting, nurses, doctors, prison officers, obviously. And although they do share, obviously, the types of key demands, like in job intensity, emotional demands, risks of emotional labour, emotional exhaustion and burnout, etc. They do have very different demands as well. So I think you can have a general framework that perhaps you can test in different organisational groups, but we can't really make an assumption that everybody's going to be experiencing the same types of demand, because clearly social workers are dealing with enormous complexity. They're dealing with people who are very different from themselves very often, and who may have different moral compasses and behaviours. So, not everybody deals with that type of situation. And it's very hard for them to switch off often. So the risk of affective rumination is very, very high, where they take their job home emotionally. And then, of course, that impairs their work-life balance and their well-being over the longer term. So I guess, the symptoms are the same, if you like, but we need to perhaps go to the occupation and look at these risk factors too. So, may well be in future we can use our tool and workbook adapted for other occupational groups.
I think one of the things that is always quite interesting when we do work with different occupational groups is the very many different stakeholders that are involved in decisions that are made and the way that work is done in that profession. And I imagine that within social work there are so many different stakeholders, aren't there? And they're very different stakeholders to those working in professional services or say auditing, which will have the financial authorities being much more their stakeholders. And so I suppose my closing question is, to what extent do you find it easy to work with other professions, and why is it important for us to work with other professions to make sure that we come up with the best solutions for the workers and for the organisations supporting them?
Very good question. And I feel very strongly about this because, of course, as occupational health psychologists, that's what I'd identify myself as, we can't hope to understand what it's like to work in that particular job. When I was much younger, I spent about 6 months working in the Department of Social Work. And I remember thinking, my gosh, this is really stressful. My line manager, who was a social worker, I never met because he was off sick with stress for all of that time. And I remember thinking at that time, even before I started thinking about doing psychology, as a job, what is it about this job? And I think part of the success story of our work over the last 10 years with social workers is that I was able to join together with somebody who knew what the job was like, who was very, very aware of the ins and outs of the job. She'd worked with people who'd experienced, child abuse, etc. And she was very, very experienced indeed. Now, it's very difficult often to get a way in to organisations, as I'm sure you'd agree. And I think if you have somebody who's able to speak the language, who is respected as a fellow professional, and who has vast knowledge of that organisation, it's really it's really important. Another example, I think, if we have time, is when I was first commissioned to do the work with prison officers. It was through the Prison Officers Association, and I knew absolutely nothing about prison officers, apart from what I'd seen on television. Series like Porridge and drama about what it was like working in prisons, and it seemed pretty stressful to me, but I had no idea. So I spent a very long time talking to people before we even started thinking about what measurements to use, about what it was like. And some of these conversations were actually quite traumatic, but we felt that we got some kind of glimpse, I think, before we made a start. So in the absence of being able to work with somebody, as a professional, it's very important to consult with people and get this in-depth knowledge, I think, as much as you can. So, I'd advise everybody out there, if they can, to do that, because we can't really assume, can we, what people's jobs are like.
Absolutely, and it really links into having that evidence-based approach where you're not only taking the evidence that you have, but gathering stakeholder views and gathering
Oh, definitely.
the employee views, so you can really try to see it from all the different lenses and the different pressures.
Yes, and I think that's why I think your work is so excellent, because you've always had that at the heart. Consulting with different stakeholder groups rather than imposing our views of what you're doing.
And I think as any practitioner trying to implement something, it's so important to do that, isn't it? To look around the organisation, even on a micro level, to think within my organisation, how many different stakeholders are there that we need to bring on board, whether we're implementing a finance system or looking at trying to review their performance.
Certainly, fundamental in our work with social workers has been this notion of co-producing. So we've been working with social workers all the way along, so that they have co-produced. They've co-produced the tool, they've co-produced the workshop, and the workbook. So it's really really useful. Then you get lots of feedback, obviously, which is quite difficult sometimes. The volume of feedback to deal with, but it's worth it. It's worth it in the end.
Absolutely. Well, on that wonderful note, we'll close our interview and say thank you ever so much for joining us to share your insights. I think so much that we can learn about social work itself through reading your work, but also so many translatable findings that that could really help shape how we think and build resilience in other organisations and other professions.
Thank you very much, Jo.
Thank you. Goodbye.
Bye.